This is hopefully a practice-changing study, and I'll be just talking about the design of the trial and the progress so far. So PACIFIC is a multicenter, prospective, randomized controlled trial with co-enrollment into a sequential design. What we're doing is we are randomizing patients to either have a multiparametric MRI, which is the standard of care, or a biparametric MRI. And we're assessing non-inferiority of biparametric MRI compared to the gold standard multiparametric MRI. If a patient has a lesion on either of the MRI scans, they will go forward and be randomized again to either have visual registration biopsy or image fusion biopsy. And that'll be a superiority analysis, so comparing superiority of image fusion to visual registration biopsy. The rationale for the trial design is well for the trial in general is well documented. We know that the addition of contrast in an MRI, so adding contrast to an MRI makes it multiparametric. We think it only gives very, very minor benefits to the patient. However, it comes at a cost, not only an economic cost, but also environmental cost of using gadolinium, as well as the requirement to have a clinician on site when administering gadolinium contrast. And the time taken. So a multiparametric MRI can take somewhere between 30 to 40 minutes, depending on the center, whereas a biparametric MRI is much shorter, about half the time, somewhere around 15 minutes or so. In terms of the second randomization and the second part of this trial, comparing visual registration to image fusion biopsy, there have been a number of paired cohort studies assessing the two. And it appears that visual registration biopsy is perhaps slightly less accurate than image fusion biopsy. But image fusion biopsy obviously comes with additional equipment cost. So we're doing a second randomized control trial within PACIFIC to compare the two.